Hi, this is Lindsay Sullivan, back live at Bone and Joint Institute, continuing our Facebook Live series with our physicians. So today I have Dr. Jeff Watson with me. Welcome, Dr. Watson.
Thank you so much. Always good to be here.
Awesome. And today we're talking about some common foot and ankle injuries. So Dr. Watson will kind of dive into some of the most common, especially athletic injuries that he sees here in the clinic. But first, Dr. Watson, tell me a little bit about yourself and about your specialty.
Well, I'm a native of Knoxville, Tennessee, so go Vols.
Go Vols.
I have a couple of degrees from the University of Tennessee, and so I grew up in Knoxville, ended up marrying a Nashville girl, so I live here now, and we'll be here for quite some time. I did some training in orthopedics in Mississippi for orthopedics for 5 years, and then did a special 1-year fellowship in foot and ankle, and so I am kind of the foot and ankle specialist of our group, along with Dr. Durr, and help to take care of those specific patients.
So today we're talking specifically about foot and ankle injuries. So what's one of the most common foot and ankle injuries that you see in your clinic each day?
So ankle sprains are such a common thing. It's been reported that about 20,000 ankle sprains happen every day in the United States. That's quite a bit of patients.
Quite a bit of patients.
And so that is one of the more common things we see, certainly with basketball and the tail end of the season, and then as we start into spring sports. I mean, this is kind of a common thing we see both with soccer, football, and basketball in particular.
So what exactly is an ankle sprain?
So what is a sprain? Sprain, strain, tear, all those things we do kind of use somewhat interchangeably. A ligament is something that holds bone to bone, and if it goes too far and stretches, that's what a sprain is. And so in the ankle, one of the ligaments on the outside is more common to sprain, leaving you with instability or the feeling of your ankle giving out.
So if someone comes into your office or any one of our orthopedic urgent cares, what's the first treatment for an ankle sprain?
Yeah. So it's always nice to know what it is. Sometimes you turn your ankle and it may just be a minor discomfort, and those you can usually just sort of go along. But if you can't put weight on your ankle, that's a good indication. Maybe we should get an X-ray just to be certain it's not a fracture, because that's something that I just don't have X-ray vision. I often get phone calls from friends and family and like, hey, what do you think? I'm like, I still can't see through your skin. So an X-ray is helpful just to know, is it sprained or not? Is it a fracture or is it a sprain? Sometimes it can be hard to tell. So I do think that's a good reason. If you can't put weight on it, good idea to get an X-ray.
Okay, and then so say there's no fracture, and what do you do then? Do you go brace? Do you go boot? Do you go cast? Do you go nothing?
Yeah.
What do you typically do?
It's a spectrum, right? So if it's a pretty mild discomfort, you can put weight on it. We usually move you more towards an ankle brace. An ankle brace is helpful because it can decrease your chance of spraining your ankle by about 50%, so that's good odds. And then if it's generally all those sprains, we kind of treat them with like 3 days of rest, ice, and elevation, the old Rice treatment. And then usually getting back into activities is okay to tolerance. And so if I got an athlete that wants to get back on the basketball court, we'll put them in an ankle brace and let them go as they can tolerate. A boot is really more reserved for those that have a pretty significant ankle sprain. There are grades of ankle sprains, and you can imagine the worse it is, the harder it is to put weight on. And so sometimes a brace just isn't enough. You got to go for the boot.
Gotta go for the boot.
I usually don't like to do the boot for a few days though, like no more than about 10, because you can imagine you get stiff as time goes on, and you get some atrophy, and that's the problem there. You want to kind of get back as quick as you can, and that can be self-limiting too.
Okay, and what about rehab? Do you do any type of physical therapy for an ankle sprain?
Yeah, I offer that to most patients. In truth, most people defer, although there are studies that suggest that gets you back faster. And I do think for those patients that have kind of gone a few weeks and not gotten better, therapy can get those patients stronger and back even without surgery.
Perfect. And are ankle sprains ever surgical?
They are, only about 5% of the time. So it's one of those things that not all of them need surgery, and really fixing them acutely is not a common thing. So what the surgery is called a Brostrom procedure, where we actually take the ligament that's kind of healed long, and then we cut it and oversew it together. Generally, we'll kind of give it about 3 months to let it heal on its own first before jumping into surgery, just because most of them, 95%, do well.
Do well, okay. Well, awesome. And so we've talked ankle sprains, one of the most common injuries in your clinic. What's another common injury that you're seeing, especially in the sports population?
Oh yeah, Achilles. You know, both Achilles tendon ruptures and then also just tendonitis. You know, this is kind of a time where the Nashville half marathon, full marathon's coming up in the next couple months. So
last weekend in April.
Yeah, and then Tom King is one downtown. So this kind of, it seems to be like the more running season too, even though it's cold. And so a lot of that stiffness when you first get up in the morning, that type of tendonitis, that's a common thing we're seeing in clinic right now. And so therapy, whether that's like a one-time visit for a home program or going to formal therapy for a few weeks, it's got about a 75% chance of getting you better. So pretty good odds we can get you back on your feet and doing what you want to do. And then ruptures too. Right. So rupture, you know, that sudden burst of like, I think somebody just kicked me in the back of the leg is something we see pretty commonly too. And you know, basketball, those explosive sports, tennis. You know, we're seeing that occasionally, and those, you know, somebody who's active and wants to get back to those activities, surgery is your best bet to get you back to doing those things.
Okay, and after, so you do have to fix an Achilles rupture. What does the recovery time look like after that? Yeah,
so we usually give the tendon a little bit of a head start before strengthening because we don't want to re-rupture it. And so we usually give about 6 to 8 weeks of being in a boot before progressing you back to therapy to get strong again. And so being in a boot for about 6 to 8 weeks is kind of the scenario there. You know, the Achilles, you can see any athlete that has an Achilles rupture, it is about a year to get fully back. We try to push that envelope as much as we can, but it can sometimes be a bit of a bear of a recovery.
Absolutely. And at Bone and Joint Institute, we're all about technology and just the most advanced treatments. Anything new especially in the Achilles surgery world?
Yeah, one of my favorite things is the minimally invasive way of fixing Achilles, because, you know, we used to make these really long incisions, which, you know, sometimes need to be done in certain instances, but most Achilles ruptures, we can make a small 1-inch incision and use a jig to be able to capture the tendon above and below and sew it back together through a kind of a tiny incision. And so I think that creates less scarring and it decreases the wound issues we used to have with Achilles surgery, and it's a pretty slick way of getting you back on your feet.
Perfect. Well, Dr. Watson, thank you again for talking about those the Achilles injuries and the ankle sprains in your clinic. Each time we do the Facebook Live, I always talk about the comprehensiveness of Bone and Joint Institute and what it means for the patient experience. Can you talk a little bit about the patient experience when they come here to Bone and Joint?
Yeah, we want it to be the best it can be, and we're certainly taking all the advice from all the reviews we get from people coming in to try to improve that process. We've tried to use technology to make things flow a little bit better. I'm currently looking on different ways of making that better, just as a small aside. But you know, I think everything from physical therapy being right down the hallway to we have a MRI that we are probably going to get in the next 6 months that'll be in the building to help to capture the imaging, to be a one-stop shop. So I feel like we're trying to get as a comfortable work environment that is really motivated and eager to please as much as possible.
Well, awesome. Well, Dr. Watson, again, thank you so much for your time during the lunch hour today. And for any questions or to schedule an appointment, you can either go to our website at boneandjointtn.org or give us a call at 615-791-2630. Dr. Watson, thank you again, and we'll see you next month. Thank you.